Upper limb surface anatomy. Shoulder girdle. The shoulder girdle consists of the scapula and the clavicle and is supported by powerful muscles. The anterior surface of the clavicle, the acromion, and the spine of the scapula are subcutaneous and palpable. The shoulder girdle connects the humerus of the upper limb to the axial skeleton. Clavicle and scapula. Palpable structures. Coracoid process. The tip of the coracoid process is palpable immediately below the lateral third of the clavicle and deep to the medial margin of the deltoid muscle. To palpate the coracoid process, place your hand on the deltoid muscle and grab it with your thumb. Your thumb will now be in contact with the coracoid process. The acromion. The acromion is an anterolateral projection of the spine of the scapula. It arches over the glenohumeral joint and articulates with the clavicle at the acromioclavicular joint. Palpate the acromioclavicular joint by pressing medially above the acromion. The scapula. Count the vertebral spines down from the 7th cervical vertebra, which is the most prominent, to the 12th thoracic vertebra. The medial border of the scapula crosses the 2nd to the 7th rib. Note the first rib cannot be palpated. Angle of the acromion. Palpate the angle of the acromion with your thumb and index finger. This is an important landmark from which measurements down the arm are made. Surgical neck of the humerus. Palpate the surgical neck of the humerus. It is covered by the deltoid muscle, but it can be palpated quite easily as it lies approximately 5 centimeters below the angle of the acromion. This is important since it is a site of fracture and is related to the axillary nerve and the circumflex humeral arteries that pass from medial to lateral behind it. They may be damaged in surgical neck fractures or by shoulder dislocations. Greater tubercle of the humerus. The greater tubercle of the humerus is lateral and projects beyond the acromion. It forms the roundness of the shoulder joint. Grasp it through its covering deltoid muscle. Shoulder girdle muscles. The following extrinsic muscles suspend the scapula from the trunk: Pectoralis minor, Trapezius, Levator scapulae, Rhomboid major, Rhomboid minor, and Serratus anterior. The following intrinsic muscles attach the scapula to the humerus: deltoid, Teres major, and the rotator cuff muscles, the Supraspinatus, the Infraspinatus, Teres minor, and the Subscapularis muscles. The Pectoralis major and Latissimus dorsi muscles both attach the trunk to the humerus. Muscles in motion. Pectoralis major muscle. The pectoralis major muscle attaches the trunk to the humerus. The clavicular head arises from the medial half of the clavicle. The sternocostal head arises from the lateral side of the manubrium. the sternum, the upper 6 costal cartilages and ribs, and the external oblique aponeurosis. Laterally, the two heads converge into a narrow tendon that passes deep to the deltoid muscle and inserts into the lateral lip of the bicipital groove of the humerus. The clavicular head fibers overlaps and inserts lower than the sternocostal head fibers that insert higher into the capsule of the shoulder joint. The pectoralis major muscle forms the bulk of the anterior axillary fold. Pectoralis major muscle, tear. Although pectoralis major muscle injuries are rare, heavy bench pressing may lead to a tear in the tendon of the clavicular head of pectoralis major muscle, and it is extremely painful. It must be surgically reinserted onto the humerus at the earliest convenience. Pectoralis major muscle flexes, adducts, and medially rotates the humerus at the glenohumeral joint. The clavicular head fibers flex and adduct the humerus. The sternocostal head fibers medially rotate and adduct the humerus. The medial and the lateral pectoral nerves that originate from the medial and lateral cords of the brachial plexus innervates the pectoralis major muscle. This muscle as a whole is a powerful adductor and medial rotator of the humerus. It is also an accessory muscle of respiration. Pectoralis minor muscle. The pectoralis minor muscle suspends the scapula from the trunk. The pectoralis minor muscle lies deep to the pectoralis major muscle. It arises from the upper margins of the 3rd, 4th, and 5th ribs and inserts into the medial and upper aspects of the coracoid process. The pectoralis minor muscle protracts the scapula by pulling the scapula anteriorly on the thoracic wall. The pectoralis minor muscle is an important landmark for the axillary artery and the cords of the brachial plexus. The medial pectoral nerve that arises from the medial cord of the brachial plexus innervates the pectoralis minor muscle. Deltoid muscle. The deltoid muscle attaches the scapula to the humerus. The deltoid muscle is large and triangular in shape. Its base arises medially from the lateral third of the clavicle, the acromion, and the spine of the scapula. It forms the smooth contour of the shoulder joint. The upper end of the humerus can be palpated through the relaxed deltoid muscle. The borders of the deltoid muscle are usually visible when the arm is abducted against resistance. Its apex inserts into the deltoid tuberosity, which is located at the middle of the lateral surface of the humerus. The deltoid muscle is the primary abductor of the humerus at the glenohumeral joint. It abducts the arm beyond the initial 15 degrees, accomplished by the supraspinatus muscle. When the arm is abducted to about 90 degrees, the greater tubercle of the humerus comes in contact with the acromion. Lateral rotation of the humerus then takes place so that more movement is possible. The anterior fibers of the deltoid muscle cause flexion and medial rotation. The posterior fibers cause extension and lateral rotation. The axillary nerve that arises from the posterior cord of the brachial plexus innervates the deltoid muscle. Axillary nerve damage. Intramuscular injection. Intramuscular deltoid injections are given within 4 cm from the angle of the acromion, that is, above the surgical neck of the humerus, to avoid damaging the axillary nerve and the circumflex humeral artery, which enter the deltoid muscle from behind the surgical neck of the humerus. Axillary nerve damage, fractures and dislocations. Falls onto an outstretched hand can result into fractures of the clavicle. This usually occurs at the junction of the middle and lateral thirds. The shoulder joint is least supported inferiorly, and a dislocation in this direction is usually due to a blow in the upper lateral aspect of the abducted humerus. The axillary nerve is at risk. Assess the loss of sensation due to axillary nerve damage over the regimental patch, which is the skin located over the humeral attachment of the deltoid muscle. This examination is less painful than testing the action of deltoid in the immediate post-traumatic phase. The surgical neck of the humerus can be palpated quite easily, as it lies approximately 5 cm below the angle of the acromion. It is covered by the deltoid muscle. The surgical neck of the humerus. It is a site of fracture and is related to the axillary nerve and the circumflex humeral artery that pass from medial to lateral behind it. Latissimus dorsi muscle. The latissimus dorsi muscle attaches the trunk to the humerus. The latissimus dorsi muscle arises from the spine of T7, the spinous processes, the supraspinous ligaments of all thoracic, lumbar, and sacral vertebrae, the lumbar fascia, the posterior third of the iliac crest, and the last 4 ribs. The muscle is also attached to the inferior angle of the scapula, producing medial rotation, and prevents the angle from jutting out of the chest wall during shoulder movements. Palpate the upper border of the latissimus dorsi muscle, which runs horizontally across the inferior angle of the scapula from the 7th thoracic spine to the posterior axillary fold. The fibers of the latissimus dorsi muscle pass upwards and laterally to insert into the floor of the bicipital groove of the humerus, after spiraling around the teres major muscle. The latissimus dorsi muscle is a powerful adductor of the humerus at the glenohumeral joint. It also extends and medially rotates the humerus. Its costal attachment helps with deep inspiration and forced expiration. The thoracodorsal nerve that originates from the posterior cord of the brachial plexus innervates the latissimus dorsi muscle. This muscle is used extensively during climbing. Teres major muscle. The teres major muscle attaches the scapula to the humerus. The teres major muscle arises from the lateral side of the inferior angle of the scapula below teres minor. It inserts into the medial lip of the bicipital groove of the humerus. The teres major muscle medially rotates and adducts the humerus. It also stabilizes the shoulder joint. It is innervated by the lower subscapular nerve, which arises from the posterior cord of the brachial plexus. The teres major muscle forms the lower part of the posterior axillary fold laterally and the latissimus dorsi muscle medially. Trapezius muscle. The trapezius muscle suspends the scapula from the trunk. The trapezius muscle arises from the medial third of the superior nuchal line, the ligamentum nuchae, the spinous processes, and the supraspinous ligaments down to T12. It inserts to the lateral third of the posterior border of the clavicle, the acromion, and the superior lip of the spine of the scapula. The spinal accessory nerve innervates the trapezius muscle. The trapezius laterally rotates, elevates, and retracts the scapula. If the scapula is fixed, it extends and laterally flexes the neck. Levator scapulae muscle. The levator scapulae muscle suspends the scapula from the trunk. The levator scapulae muscle arises from the posterior tubercle of the transverse process of the first to the fourth cervical vertebrae and inserts to the upper part of the medial border of the scapula. It lies deep to the trapezius muscle and forms some of the muscle bulk of the posterolateral aspect of the neck. The levator scapulae muscle raises the medial border of the scapula. The dorsal scapular nerve and the third and fourth cervical nerves innervates it. Rhomboid major muscle. The rhomboid major muscle suspends the scapula from the trunk. The rhomboid major muscle arises from the spine of T2 to T5 and the supraspinous ligaments. It inserts to the lower half of the posteromedial border of the scapula. The rhomboid major muscle retracts the scapula and rotates the scapula to the rest position. The dorsal scapular nerve innervates the rhomboid major muscle. Rhomboid minor muscle. The rhomboid minor muscle suspends the scapula from the trunk. The rhomboid minor muscle arises from the ligamentum nuchae and the spines of C7 and T1. It inserts to the posteromedial border of the scapula just above rhomboid major muscle. The rhomboid minor muscle retracts the scapula and rotates the lower scapula back to its rest position. The dorsal scapular nerve innervates the rhomboid minor muscle. Serratus anterior muscle. Serratus anterior muscle suspends the scapula from the trunk. The serratus anterior muscle arises from the upper 8 ribs. It inserts into the inner medial border of the scapula. The serratus anterior muscle laterally rotates and protracts the scapula. Long thoracic nerve of Bell. The long thoracic nerve of Bell and the lateral thoracic artery passes down the medial wall of the axilla in the mid-axillary line. The long thoracic nerve of Bell innervates the serratus anterior muscle. The thoracodorsal nerve passes down posterior to the mid-axillary line. The thoracodorsal nerve innervates the latissimus dorsi muscle. Damage to the long thoracic nerve of Bell must be avoided in axillary surgery, for example, in breast cancer surgery. If this nerve is damaged, this would result in winging of the scapula. There will be impaired shoulder abduction and loss of function. Rotator cuff muscles. The rotator cuff muscles that is, the Supraspinatus, Infraspinatus, Teres minor, and the Subscapularis muscles, attach the trunk to the humerus. Subscapularis Muscle. The Subscapularis muscle arises from the subscapular fossa. It inserts to the lesser tubercle of the humerus and the capsule of the glenohumeral joint. The subscapularis muscle medially rotates the humerus and stabilizes the glenohumeral joint. It is innervated by the upper and lower subscapular nerves that arise from the posterior cord of the brachial plexus. The subscapularis bursa lies deep to the subscapularis tendon and is usually connected with the joint space. Supraspinatus Muscle. The supraspinatus muscle arises from the supraspinatus fossa and the spine of the scapula. It can be palpated deep to the trapezius muscle. It passes laterally under the acromion and inserts onto the greater tubercle of the humerus and the capsule of the shoulder joint. The subacromial bursa lies above the supraspinatus tendon. The supraspinatus muscle abducts the humerus from 0 to 15 degrees, and it stabilizes the glenohumeral joint. The suprascapular nerve, which arises from the upper trunk of the brachial plexus, innervates the supraspinatus muscle. Frozen shoulder. Inflammation of the attachment of the supraspinatus tendon to the greater tubercle is one cause of frozen shoulder, or rotator cuff syndrome, or impingement syndrome. Raising the arm becomes extremely painful and eventually can cause irreversible deterioration of the supraspinatus tendon through calcification and even tearing. Infraspinatus Muscle. The infraspinatus muscle arises from the infraspinatus fossa of the scapula. It inserts to the greater tubercle of the humerus and the capsule of the shoulder joint. The infraspinatus muscle laterally rotates the humerus and stabilizes the shoulder joint. The suprascapular nerve, which arises from the upper trunk of the brachial plexus, innervates the infraspinatus muscle. Teres minor muscle. The teres minor muscle arises from the lateral border of the scapula above teres major. It inserts at the greater tubercle of the humerus and at the capsule of the shoulder joint. The teres minor muscle laterally rotates the arm and stabilizes the shoulder joint. The axillary nerve, which arises from the posterior cord of the brachial plexus, innervates the teres minor muscle. The infraspinatus and the teres minor muscles pass posterior to the glenohumeral joint and are lateral rotators. The teres major and the subscapularis muscles pass anterior to the glenohumeral joint and are medial rotators. Together, the supraspinatus, infraspinatus, teres minor, and the subscapularis muscles are termed the rotator cuff muscles.